Okay, hey, hello everybody. It's Dr. Earle. We're here at Pure Plastic Surgery today, and it's Hump Day with Dr. Earle. So thanks everybody for joining. As you all know, Hump Day is the time that I get to spend with you guys and go over some plastic surgery topics and of course answer all those burning questions, okay? And you know you're gonna get good and reliable information because it's coming from a double board certified plastic surgeon, Duke trained, Ivy League educated, okay? So today, we are going to talk about something that comes up often. It comes up often, and you know, in one way or another. And I want to kind of get into it a little bit, and of course, kind of give you what are the pros and cons of basically going to a clinic, or otherwise known as a high volume surgery center, versus a private practice. Okay, because this comes up all the time, especially when people ask the question like, why are you more expensive? You know, why is Pure more expensive? Okay, and so I want to kind of talk about that because I don't think many people actually understand the difference, or that there is a difference between these two things. Okay, and then of course once we're kind of done with talking this, I'll be happy to answer any other questions that you may have regarding any plastic surgery topic for today. Okay, so we're going to discuss the difference between a clinic. And in particular, I'm talking about the high volume plastic surgery clinics. So, you find many of these here in Miami, okay, versus a private practice such as Pure, okay? And you may ask, the first question you may ask is, well, how do you know anything about clinics? Well, actually, I work there. So, before starting Pure, and actually at the beginning of Pure, I did work at some of these clinics. And so I know what's going on there, from the inside. So I do have reliable information there as well. Okay, so the first thing then, though, let's start with the surgeon. So a clinic will have multiple surgeons, okay, and these surgeons are not necessarily plastic surgery trained surgeons, okay. So you can have, you can have potentially a general surgeon. You can have someone that's an OB-GYN, okay, a gynecologist. In the state of Florida, you're not required to have formal training in plastic surgery or to be board certified by the American Board of Plastic Surgery to perform plastic surgery, okay? So you'll have any kind of type of surgeon at the clinic, versus a private practice, especially one such as here at Pure, where you're going to have most likely a plastic surgery specifically trained surgeon. Okay, of course, you gotta do your research. So just because it's private doesn't necessarily mean that, but certainly that's the case here at Pure. Okay, so if you're not necessarily trained in plastic surgery, then it's impossible for you to be board certified in plastic surgery. Okay, so they're not going to be board certified by, and specifically by, the American Board of Plastic Surgery, the ABPS. So when you see an ad on social media or whatever, and it says board certified surgeons, the follow-up question has to be, board certified by whom? Okay, are they board certified by the Board of Gynecologists? Well, that's great, but how is that helpful, right? Or are they boarded by the Board of Cosmetic Surgery? Okay, that's not the same thing as the American Board of Plastic Surgery. The amount of training and everything to get that is much, much different. And the American Board of Cosmetic Surgery is not a recognized board by what's called the ABMS, or the American Boards of Medical Specialties, which is kind of the umbrella which certifies all the boards here in the U.S. So it's not recognized by that. Okay, as opposed to private practice such as Pure, where you're going to get a board certified or double board certified plastic surgeon, or board eligible plastic surgeon. So board eligible just means you haven't taken your oral exam yet. It takes a while to be able to do that, such as Dr. Earle. So she's done everything. She's fully trained plastic surgeon. She's actually board certified in general surgery. She's done her written examination for plastic surgery, and all she has left to do is her oral examination to be a fully board certified by the American Board of Plastic Surgery. I, of course, am completely certified by the American Board of Plastic Surgery, and of course also certified as a general surgeon as well, which makes the two boards or double board certification. Okay, So that's a very, very big difference there. So the type of training and the type of board certification that the surgeons have.
Is it true that a dentist can perform plastic surgery?
Yeah, so in the state of Florida, a dentist can perform plastic surgery. Now by that, you typically mean someone who's gone through what's called OMFS, or oral maxillofacial surgeon. So it's not simply a dentist, but it is someone who went through dental school and then went and did that OMFS training. And those basically surgeons are able to perform plastic surgery here in the state of Florida, even if they haven't ever gone through formal plastic surgery training, and of course, and are not boarded by the American Board of Plastic Surgery. Okay. So the next thing that you're going to find at these clinics is you're going to find multiple surgeons. They're going to have 4, 5, 6 surgeons, okay, on their roster. All right, and you know, you a lot of the times you go there or you inquire thinking that you're going to be going to one surgeon, and then all of a sudden you get switched out, or they try to convince you to go to some other surgeon. Okay, and that happens a lot, especially if, say, for example, one of the surgeons didn't hit their numbers for that week or that month. And so then you're going to have, you know, the sales reps there trying to see if you want to be going to to that other surgeon to try to keep them all busy. So there's going to be multiple surgeons there. It's not unusual sometimes to get switched out from one surgeon to another without you even kind of really knowing about it, or once you're already there and it's too late and you've already kind of paid for all your flight and your stay and everything else. So that's another thing that happens there. Well, of course, in private practice, you're going to the surgeon that you choose, okay? It may have 1 or 2 surgeons, depending on the practice there, but you're going to the specific surgeon that you have chosen, and there's not going to be a change there last minute. You're not going to arrive, for example, to Pure, and then we're going to say, oh, you know what, tomorrow you're going to go with, you know, surgeon X or Y. That's just not going to happen, okay? All right. And then, of course, the volume, right? These are definitely high volume clinics, high volume centers. So they have multiple surgeons doing high volume. Each surgeon may be doing upwards of, you know, 8, 10 high or more surgeries a day. Okay, I think, you know, that's a bit unreasonable. Yeah, different surgeons have, you know, have different limits, and, you know, perhaps there's a surgeon that feels that they can only do, say, 3 surgeries a day. There's someone comfortable doing 5. But once you start getting into like 8, 10, you know, 12 or whatever, you know, for a single surgeon a day, I think that's kind of beyond anyone's real capability. So, you know, definitely high volume surgeons. You don't want to be number 15, right? You don't want to be number 15 starting at 7, 8 p.m. at night, a surgery, okay? No matter how strong someone is, no matter, you know, how educated they are, how much training they've had, okay, there is a point where you reach fatigue, okay, where you get tired, and, you know, you're operating at 8, 9, 10, 11 at night on your 12 or, you know, whatever case it is, you're not going to be fresh, and therefore, you know, safety starts to become a concern. Okay, or as opposed to a private practice, you're going to have reasonable volume, right? I know my limits. I set my limit at 5 surgeries a day. That's as much as I'll do. Do I have the demand to do more? Yes, I do. You know, that's why I'm booked out through May. Okay, but am I gonna do that? No, right? Because I know my limits. I know that, you know, I can be there. I can be fresh. I can provide good results up to about 5 surgeries a day. But once, you know, I start getting beyond that, then I start getting tired. I start getting fatigued. It's not fair to the patient. You know, and then, you know, safety may start to come down. And so I set my limit there, okay? And so you're gonna have reasonable volume at the private practice, all right?
Doctor, is it realistic that one surgeon can perform 10 surgeries a day?
You know, I would say realistically, no. I mean, of course, it depends on the procedure. So, for example, if you're doing like say carpal tunnels, right? There are hand surgeons out there that'll do 10 carpal tunnels in a day. Well, that's okay. Carpal tunnels is a very short procedure. It takes about 15 minutes or so, you know, and potentially you could do that. From the plastic surgery point of view, can you do 10 breast dogs in a day? That may be something that you can do if you're efficient. Like, say, for example, I can do a breast dog in 30 minutes. Is it something that can potentially be done? I think so, but I still think it's too much. I think you start getting fatigued after that, and certainly for anything more than that, whether it's a tummy, lipo, BBL, mommy makeover, you can't really physically safely do 10 of those in one day.
Will you ever increase your 5 surgeries a day limit?
No, and actually, I still think of myself as kind of young and sprightly still, even though, as you can see, my beard is getting quite gray. But no, actually, what's probably going to happen, whatever, 5 years down the road, is that it's going to go the other way. I'm going to start going down from, say 5 surgeries to 4 to, whatever it is. I have to listen to my body, and I have to be fair to the patients, and I have to make sure that I'm able to, deliver with every single surgery, whether you're the first case of the day or the last case of the day. And so that's why I set those limits to myself. Nobody else is setting that limit, and I'm setting it to myself.
Thank you.
All right, so the next thing then, of course, is communication and access to your surgeon. So a lot of times in the high volume centers, you're not communicating with the surgeons directly. You're communicating through, patient care coordinators or salespeople, and access to your surgeon is very, very limited. You typically see the surgeon the day of surgery. You've never kind of spoken and seen that surgeon before. And it's like the same day, and then the surgeon does the surgery, and then you never see the surgeon afterwards. You see your post-op or your follow-ups are done by either like a nurse practitioner or a medical assistant, and then that's it. Okay, so communication with the surgeon is very, very limited. Access to the surgeon is extremely limited, typically in these situations, because they want their surgeons to be in the OR at all times. Okay, that's quite different than at a private practice such as Pure, where of course you'll be seeing me multiple times. Unless it's a really like dire circumstances, we typically see our patients at the very least a day before surgery. We go over the plan. Before that, we may have had virtual consultations on video as well. Those are also available. And then of course you're going to see me after surgery, and then there's going to be continuous communication. Of course, yeah, we have our staff. You can go through the staff, but if you need to do like another virtual consult with me, that's possible. If you need to communicate through Clara, which is our HIPAA compliant system, that's possible. And so there's just a lot more access to the surgeons and a lot more communication with the surgeon in the private practice, and definitely for, I would say, at least kind of 98% of our patients, you're going to see us before surgery. There may be special circumstances. For example, we're human too. Sometimes I have to go on vacation to recharge. Maybe they're having an emergency, etc., etc. I'm not going to say it's 100% of the time. Remember, nothing in medicine is 0% or 100%. We definitely do our very, very best to provide that for our patients. I think is very, very important.
Quick question. So you do 5 surgeries a day and only 5 surgeries max. Then what is the last time slot available?
Well, it's going to vary because it varies on what types of surgeries there are, etc., etc. But typically, it's not much later than 2 p.m. or so. It's pretty rare that we're starting, later than that. Again, can it happen on occasion? It's possible, but it's not very, very common. And it's also, most patients, of course, if you're starting, say, at 2 or 3, you'll be done by 5. Most patients are out, no later than like 6, 7 max. We're definitely not starting surgeries in the middle of the night. That's just not something that we're doing. That's happening. Okay. Mm-hmm. All right, and then in terms of communication, and it's not just also about the surgeon, but also I think about the staff in general. So I think our staff, they're always available, especially through Clara. You can always communicate with your patient care coordinators after surgery. We have 2 wonderful nurses. We have our nurse practitioner Jenny and our nurse Sarah, and they answer a lot of your kind of post-op questions, and they can take care of a lot of the post-care needs as well. They're truly excellent. And so really all our staff is there and available. And I think communication is one of the most important things, especially in this environment. And patients have to feel comfortable. They have to feel like that we're listening, and they also have to know that, you know, if anything were to happen, that we're going to be there for them. And so I think communication is extremely, extremely important, and we put a lot of effort in order to always be, have easy access and communication with our patients. Okay.
So when you started a private practice, what was the main thing that you wanted to implement?
Yeah, so a lot of these things here. Okay, so what we're going to talk here in a second. Okay. But it's basically, I want the patients to come in and feel like not like a number, but to feel like, you know, they're like a unique patient, that we're taking specific care of them, that we're communicating with them, and that we're educating that patient. And so a lot of the stuff that I do has to do with, of course, with education and communication, and making sure that the patients feel comfortable when they come here to Pure. So I spend a lot of time, you know, with the hump days and the Facebook groups and everything else, educating the patients, making sure that they get to know us, they get to know Pure, they get to know me, so that when the patient comes here, they kind of know what to expect, and they're educated and they're comfortable, and they feel like we're taking great care of them. And I think that was lacking when I worked at the clinics, and that's something that we really try to strive to do here at Pure. And of course, the next thing that we're going to talk about, which is patient safety, which is always our #1 priority. So, so the clinics, well, they have to do the bare minimum, otherwise they can't function, right? And that's being, that's being certified by the Florida Department of Health. So if you don't have that, then you're not even a clinic, right? You're one of these, you know, you're getting something done in somebody's basement, which, please, for the love of God, don't ever do that, okay? So yeah, in order to function, you have to be certified by the Florida Department of Health, okay? And that's kind of the bare minimum that you have to do. Now, if you really want to kind of, you know, talk the talk and walk the walk, okay, and if you're really saying that patient safety is your #1 priority, then you go beyond that, right? You go to the highest level of certification that you can get as an office-based surgery center. And the highest level certification that you can get is JCO, the Joint Commission, the same people that certify all the major hospitals, okay? And that's what we have here at Pure. What does that mean? That means that we have to go the extra step. We have to go the extra step. There's hundreds and hundreds of things that we need to do in order to be certified by JCO, okay, in order to ensure the quality of our sterilization techniques, okay, and the quality basically of our surgery and our procedures, and to ensure the highest safety for our patients, okay? And so we've done that. We are JCO certified here at Pure. There is no higher certification for an operating room in an office-based surgery setting than that, and we've done that, right? So I think that kind of demonstrates that we're just not talking about safety, not actually, you know, doing what we say that we're talking about here. Okay, so that's a big differentiator right there. All right, and then, you know, I think we also do, you know, certain things that kind of demonstrate that we do care about our patients. Okay. So whereas, yes, we want to have the lowest complication rates possible, okay, the reality is that if you're having plastic surgery, okay, the complication rates will never be 0, all right? The only way to have a 0% complication rate is to not do surgery, okay? But since we understand that that is the reality, okay, and yes, we try to minimize those rates as much as possible, but we understand that the reality is that they'll never be 0, then we provide a little extra basically insurance for our patients, which is called CosmetiSure. Okay, as far as I know, we're one of the only, if not the only, you know, private practices that has CosmetiSure, and certainly none of the clinics do. And so what is CosmetiSure? Well, CosmetiSure provides some financial support in case you do have a complication within the first 6 weeks or 45 days of surgery, and say, for example, you have to go to the ER or end up in the hospital, okay? Is it gonna, you know, potentially cover the thing 100%? Maybe not, but it's definitely gonna help for sure, okay? Because what happens is a lot of times your private insurance won't cover anything related to cosmetic surgery, okay? And then you would potentially be stuck with 100% of the bill. Okay, but with CosmetiSure, they're going to be covering most, if not all, of that bill. All right, and we provide that for all of our patients. all of our patients. And this is a cost to us. The patient's not paying extra for this. We're paying for it for the patients, okay? But why do we do that? Okay, it's another kind of, walking the walk, talking the talk, proving that we care about our patients, okay? And that we want to just give them a little bit more kind of relief, a little bit more peace of mind, a little bit extra insurance in case something does go wrong. Of course, none of us wants that to happen, but we all have to understand the reality that if you do get surgery, complications can happen, okay? Even though we try to keep that risk very, very low, it will never be zero.
So question on that topic real quick. So after surgery, is there a number to reach a nurse, or is it Clara?
Yeah. So, well, there's both, all of the above. So if it's after surgery and it's after hours, you call the same number as the clinic, okay? But you're gonna get a machine, don't hang up. Don't hang up, stay on, okay? Eventually you're gonna get to a call center, and the call center is gonna call the person that's on call, and that person's going to reach out to you, okay? Now, if it's not something that's super urgent, then yes, you can write through Clara, and Clara's we take care of during business hours, so Monday through Friday, 9 to 5 type of deal, okay? But there is someone always available 24/7, 24/7.
Perfect, thank you.
All right.
One more.
Yes.
Actually, there's many more, but
let's do it.
So in your office right now, what happens if an emergency occurs in the OR?
Yeah, so of course, if any emergency occurs in the OR, you have to deal with the emergency here. Basically, you have to try to stabilize the patient. So that's where a lot of these safety features that we do for JACO, they're all in play. Of course, we have a crash cart, we have ventilators, we have all the medications, defibrillators, anything that you would need to deal with an emergency type situation. Now, once you do that, though, at the same time, you do have to be calling 911. You have to call an ambulance to come, because that ambulance will then have to come. It will have to, pick up the patient and transport them to a nearby hospital. Here at Pure, we are near 3 major hospitals: South Miami, Baptist, Kendall Regional. I have privileges in all 3 of those, okay? And they're all kind of within 5 to 10 minutes max from here. So that's what would happen. So we stabilize the patient, we call the ambulance then transports the patient to the hospital.
Thank you. So is there a difference between your OR and a hospital's OR?
Mostly just in size, okay? So of course hospitals have all the room that they could ever want. So ours are going to be smaller, but the ORs in the major hospitals are also certified by Joint Commission. Now they may probably have to go through some extra stuff that we don't have to, just because of their sheer size and and volume. But in general, in terms of a lot of the safety features, instead of emergency and stuff like that, they're all going to be very, very similar.
So we've learned that it's important that your surgeon's OR is JACO certified. Is that something that we should ask our surgeons or in the future?
I think asking what type of certification the OR has is a fair question. Okay, I think JACO is the highest level. The level kind of just below that, which a lot of surgeons have, and it's a pretty good level. It's called Quad ASF. So I'll just put it up here. Quad A, because it has 4 A's. So 4ASF. Okay, Quad ASF is also a fairly decent certification. So JACO's first and Quad ASF.
Thank you.
Okay. All right, but the main thing is, putting all this together is that when you go to one of these high volume center clinics, you're basically just treated like a number, right? You're just another. It's kind of like thank you next, okay? And whereas that's really not what we're going for here. It's to answer that previous question, is one of the main reasons why I started at Pure is because I want to make sure that everyone's treated like a human being. And that's why, for those of you that follow me for a long time, you know that I don't like the word dolls. I know that, in the surgery community, that word is used a lot, but I don't like the word doll because I think it kind of deprives the patient of some humanity. It makes it an inanimate object, okay? And that's why our group, we're called, there's Earle's Pearls, right? We're not Earle dolls. Each pearl is unique, right? So it kind of all comes together there. So I think we got to treat each patient as a unique person, a unique individual. We have to make sure that patient is educated. We got to make sure that we communicate well with the patient. We got to make sure that patient is comfortable, and that's a huge difference here. And we got to make sure that patient is safe. Okay, first and foremost. Okay, you know what's the most common thing? What are the most common last words for a patient before they fall asleep with the anesthesia, right? We got the IV in, and we're pushing that propofol. The patient knows they got about 30 seconds. You know what's the most common thing they say? They don't say, Dr. Earle, make me snatch, or give me an upside down heart. No, they say, Dr. Earle, please make sure I go home to my family. Please make sure I go home to my kids. Dr. Earle, please make sure I get home to my husband. Okay, those are the most common last words, because once they're really about to go under, that's what everyone's thinking about, and that's what we're always thinking about here at Pure. So safety is #1 concern. All right, and that's why a lot of this focuses around patient safety.
Thank you.
Okay, so then you would ask yourself the question, then why? So of course the question that is, why would anyone go to a high volume center? And of course the answer is simply cost, right? They're cheaper. Yeah, it's true. They're gonna be cheaper. Okay, they're gonna be cheaper. They're gonna be cheaper, and the private practice is gonna be more expensive. All right. And why is that? Well, there's multiple reasons for that. Okay, multiple reasons. There's no economies of scale, right? There's only 1 or 2 surgeons doing 5 surgeries a day. There's not 5 to 8 surgeons doing God knows how many surgeries a day. So we can't order your supplies in bulk. There's no economies of scale there. We can't spread the cost out through multiple centers, multiple surgeons, multiple cases. And so there's not going to be economies of scale. Everything is more expensive for the person that's in private practice. Okay, so things are more expensive for me. Just the supplies, the oxygen, everything that we need to do in order to be able to do these surgeries. Okay. Employees, we pay our employees well. We want to, the old saying is basically the old business saying, right? Happy employees, happy customers. If you have unhappy employees, they're not going to treat the patients well. The patients, of course, they're not going to be happy. So we treat our employees extremely well. Okay, they get paid well, they get benefits. We give them all sorts of things to make sure that our employees are happy coming to work every single day. Okay, so that's going to be an increased cost there as well. Things such as getting certified by JCO and Cosmetishore. Those are those things add up, right? You got all the extra stuff that we have to do for JCO is going to be more expensive. Okay, providing the Cosmetishore to every single patient that comes here is going to be more expensive, right? So all those things will add up, and so yes, the private practice will never be as cheap as a high volume surgery center. Okay, and so that's a little bit of a problem in the long run for the private practice, right? Because eventually, if people just care about costs, and costs start getting driven down, and then unfortunately you see a lot of surgeons who try to be in private practice, try to do all the right things, who then eventually end up working for the surgery center because it's been cost prohibitive. So that's why I think it's so important to recognize these differences, okay, and know that it's not the same. It's not the same, and there's a reason why I think the private practice is a much better option, even though it is going to be more expensive.
So for patients that aren't yours, that don't have enough money and will go to a center, is there any advice from you what questions they should ask just to pick at least the correct place to go?
Yeah, definitely. So I think you should, if you want to have some access to the surgeon, you should. And yeah, nowadays we can do we can do that a lot with video. And B, you should be certain that the surgeon that you choose is going to be the one that's going to be operating on you. That surgeon, you should research that surgeon. You should see what type of training they have, what type of surgeon they are, what type of board certification they have. Okay, and ideally it should be the training should be plastic surgery training. Okay, and it should be board certified by the American Board of Plastic Surgery. the American Board of Plastic Surgery, okay? That would be the most ideal. And I would ask these questions, you know, what type of certification is your OR? What's the volume? How many cases does the surgeon do in a day? Okay, I think these are all valid questions. And if you get nebulous answers or non-answers, I would be very worried, very worried. Okay, because these are all very valid questions. But there's a difference, and this is important. Okay, because there's a difference between price and value. Okay? Price is just a number. So yeah, oh, this is this price versus that price. Okay? Value is everything that comes with, is what you get. Okay? So yes, in the private practice, the price may be higher, but the value to you is much higher. Much higher. Okay? Because you get a board certified, you know, plastic surgeon, well-trained, safety first, and all these things that I had listed here that are different, you know, who's gonna be rested, who knows their limits, who provides cosmeticure, etc., etc. And so value is what's important, and not price.
So I got a BBL with another surgeon, and everything was great until the surgery was over. How can we make sure that post-op you're still taken care of? What questions should you ask?
Yeah, so I mean, how can you make sure? You know, it's tough to be sure, but yeah, I think a lot of that has to, you have to try to find other patients who've had experiences with that surgeon. You can look at reviews. You can look at reviews, you know, in different areas such as, you know, Google, RealSelf. You know, some of the other review sites there as well. And then, you know, you want to, you know, I think communication before surgery can kind of give you an idea of how communication is going to be after surgery, especially with the, you know, specifically with the surgeon.
If you ever get a complaint about one of your employees, what do you do?
Yeah, so that's a good question. So if we get a complaint, you know, we definitely have to look into it. So no complaint is ignored. We always want to, of course, listen to our patients and try to understand, you know, where they're coming from, and then, you know, take, you know, basically look at each individual situation to see what could have been done to, you know, potentially to handle it better. Okay, but it's not about you know, punishing people. That's not our philosophy or anything like that. So, you know, I think, you know, everyone has an opportunity to grow every single day, and so we basically can analyze the situation and see, you know, what can be done better for next time. Hopefully, of course, we try to make it right, you know, for that particular patient as well. But we also want to keep growing, we want to keep improving, we want to keep bettering ourselves as we move, you know, forward into the future.
Thank you, man. We have some questions to knock out. We're at 33 minutes.
All right.
I say it every time, but it's so fast.
Yeah, let's do a few more.
Some surgery specific questions. When can I use scar product after my mommy makeover?
Okay, so 2 weeks. All right. So we want to give the incision some initial healing time. So typically 2 weeks is sufficient. At that time, you can remove the skin tapes or steri strips and start using scar cream such as Silogen.
What happens with fat necrosis?
Okay, so let's start with, you know, what is fat necrosis? So fat necrosis literally means dead fat, okay? And so it's fat that when it was transferred, it neither got absorbed nor did it survive. And so it never got like a blood supply, okay? So those fat cells essentially died and they formed a scar ball. And that scar ball, we call it fat necrosis or dead fat, okay? So what do you need to know about fat necrosis? Well, fat necrosis is not damaging to your health, okay? Just because you have fat necrosis doesn't mean that your overall health is going to suffer. Now, it can be uncomfortable because it can feel like sometimes it can feel hard, like a scar ball, it can feel uncomfortable. But I just want everyone to know that it's not like an emergency, right? It's something that can, be dealt with as needed. A lot of times you start off simply with massage. A lot of times that helps, especially if it's not a huge area. From there you can move on to other treatments. Sometimes the steroid injection can help. Sometimes you do have to go back and kind of break it up as much as you can so your body can then deal with it. But those are kind of the different steps that you would take if you potentially have fat necrosis.
I got my first BBL with Dr. Earle. For my round 2, will I be getting the SOBI BBL? And are round 2s, do they hurt more or less?
So BBL, if you qualify for it, yeah, we can certainly do that. And by qualify for it, remember, it's typically a patient that has a little bit of a lower BMI, that their torsos are not too long or too wide, so that we can reach all the areas we need to reach through the, through the hidden and minimal access incisions.
Is it more painful?
I've seen it both ways. I would say that in general, in terms of the pain, I think it's similar to the round 1, but in terms of sometimes they do tend to be a bit more bloody because there is more scar tissue, there is more fibrosis. And so certainly, we use the cell saver pretty much for every case regardless, but certainly for round 2s or higher, that cell saver is going to be 100% mandatory.
Thank you. When meeting you at pre-op, if we decided a different procedure is needed, can you still keep your surgery date?
Yeah, for the most part, yes. For the most part, yes. And that's why we do want to meet, before the surgery so that we can plan the next day accordingly. If there are, certain things that we need to change or add or subtract, or, but basically that's the time that we get to spend in kind of in a non-rushed type of setting where we can, communicate with each other and formulate the plan so that we know exactly what's going to be happening on surgery day.
Thank you. All right, a few more questions. Do you recommend wish pics or just tell your doctor what you want?
So wish pics are okay if they're kind of within the realm of reality, okay? And so what I say, if you're going to be showing a wish pic, the best thing that you can do is just try to start with someone who had a before that looks similar to how your body looks in your before, okay? So if you simply come in with, an IG model or, some supermodel or an actress that you like, that's not as helpful because they may have a foundation which is completely different from yours. So you want to bring something, something with someone who has a foundation similar to yours, okay? Having said that, I do like the vision boards, I gotta be honest. I like the vision boards, especially if they're done well, especially if they're done with realistic expectations. And what I like about the vision board is that I typically then I take the vision board and I put it up in the OR as I'm doing the case, and it's kind of like a little check-in as I'm doing the case to make sure that I'm trying to achieve that patient's goal. So honestly, in general, I do like those vision boards, and it also shows that the patient put in a lot of thought, a lot of effort into their procedure and what they're hopefully what their outcome will be.
So for a patient who gets a BBL, what happens to their body as they age and get older? Do the results sag or change?
Not unless there is some sort of large kind of life-changing episode. So, for example, huge increase in weight, then yes, of course, everything's going to change. Huge decrease in weight, the same. Pregnancies, that can alter the body shape as well. But if you maintain a healthy lifestyle, you watch your diet, you make sure your nutrition is up to par, you do exercise, then you're able to maintain these results for a really, really long time. Now remember, like I always say, surgery is not a substitute for diet and exercise, okay? The best comes when you combine all three. When you combine diet, exercise, and surgery, that's when you truly have the best results and when they last the longest, okay? Now, in the long run, of course, seriously, no one is gonna beat gravity and aging in the long run. So yeah, when you turn, 60, 70, 80, of course things are gonna change. But I'm talking, kind of a decent amount of time.
All right, so can you do a BBL and a belly button revision at the same time?
Yeah, that can be done, and I've done that for quite a few of our patients. So typically that can be done all at the same time, yeah.
What if you have fat necrosis in your butt? Do you guys remove it?
So usually I try to I try to break it up as opposed to removal. Okay. When you do a straight removal, you have to a lot of times make an incision over the area, so it's going to create additional scarring. Then you have to remove that whole area of fat necrosis, and then you're going to leave basically a void behind, okay, which can then lead to having like a dent or something of that nature. So unless the patient is extremely symptomatic, which is rare, typically what we try to do is just break up the fat necrosis, so from one kind of larger clump to multiple little small clumps, which your body then has a much easier time trying to resorb. And then the other thing that we can do is break it up, put a little bit of new fat kind of in between there, and it kind of that softens up the entire area. And typically patients are happy with that.
Thank you. All right, last question.
All right,
I know you have to go. Let's see, go in order here. What vitamins do you recommend patients to take before surgery?
So we recommend folic acid, vitamin C, and then iron supplement. So such as Floradix or Hemoplex. Those are the ones we recommend before surgery. And those you can take all the way up to the night before surgery, and then you can start taking it once again the day after surgery to help your hemo levels come back up.
Thank you.
Okay. All right. All right, everybody. So I hope this discussion was helpful. Remember, it's all about value, not price. Okay. It's all about value, okay? And kind of a little bit on that note, I do want to remind everybody that that prices will be going up, okay, starting next year. So if you want to get the best prices right now, then now is the time to book your surgery, okay? Remember that the other thing that we do here, which is quite different, is that our deposits are 100% refundable. You won't see that at any of the centers, okay? Because, okay, we care about our patients. We know that sometimes things can change, life can happen. And so the deposit is 100% refundable until within 30 days of surgery, okay? So if you want to get the absolute best prices at Pure, okay, which means that you're going to have the most value, then you should book now for next year, okay? And not wait till after New Year, because then, prices are going to go up. Unfortunately, inflation keeps going up, and up, and we have to kind of, stay with inflation. So that's why, that's why that's going to happen. So now's the time. All right, place your deposit, no risk, book, lock in that quote, and we'll see you guys next year. Okay. All right, everybody. So I do hope everyone will join us next week on Hump Day with Dr. Earle. Take care. Ciao.